Hello, I'm Robert McMullen, MD. I'm a psychiatrist that's been in practice over 30 years, specializing in psychopharmacology, medications, and TMS, which is transcranial magnetic stimulation. I went to Georgetown Medical School, which was a wonderful place, and did my residency at Columbia Presbyterian in psychiatry. I wanted to talk today a little bit about depression and how you diagnose it, what a clinical depression is. First, we don't have any good objective measurements of depression like we do for blood pressure or anemia or other things. We do have some tests, some PET scans, and there's ways of doing EEGs that we can see that a person has a depression. However, the PET scans aren't available to the average doctor. They're just used in research. They cost a huge amount of money. I tried to get one recently for someone that had to do with the type of TMS I would do on her. And I couldn't get it because they're all reserved for researchers. So even if we're willing to pay the money, we can't get access to it. But it still doesn't tell you any more than you'd know if you just sat the person down and asked them about their depression and asked them the symptoms. There's another test called dexamethasone suppression test, which has been around for maybe 40 years or more. And that's a simple blood test where you give someone dexamethasone and see if it suppresses their cortisol level. But that's only positive in somebody who's really deeply depressed, and if they're deeply depressed, it's obvious, and you could just ask them the questions. Now, all of this may change in time. This is 2017, but in 10 years, 20 years, we're all hoping that we'll have tests that we can do that are physical tests that can tell us what type of depression this person has and perhaps predict what would be the best type of treatment. But right now we just don't have that. And we especially want that for TMS because the transcranial magnetic stimulation is a treatment where you use magnetic pulses on the brain, and we found at least 3 major areas that we can treat for depression, and then there's different ways of doing it, excitatory or inhibitory. But we don't even know which of those 3 places we should start with. If we had a way of predicting that this person's much more likely to do better with this treatment than that treatment, it would save a lot of time and money. If you do 15 or 30 treatments on an area that's not going to help them, and then you have to do it again in another area, it's prohibitively costly. Now, about diagnosing a clinical depression. We use the word depression kind of freely, that I'm very depressed, I'm unhappy, and people say, well, you should just snap out of it, go to a movie, go see friends, and that may work for the average unhappiness, but it usually doesn't work for what we call a clinical depression. And a clinical depression is not just a depressed mood, it's a whole group of symptoms. It's a syndrome. And this includes a sleep problem. You're either sleeping too much, or you're having insomnia and you can't get to sleep, or you're waking up in the middle of the night, or you wake up at 4 a.m. and can't get back to sleep. It's a concentration problem that you have to reread a sentence. You're having a hard time maybe even concentrating on what somebody's saying to you. Your energy is down. You have lassitude. Your wife wants you to go get a loaf of bread, and it's just an enormous effort just to get yourself to go do it, or to get yourself to go do your taxes. There's a problem with anxiety sometimes, that the person's also excessively anxious and worried about things and ruminating. There's frequently excessive guilt, and you think about things in the past that you could have done differently, or even things right now that you wish you could do better. And this is often associated with some low self-esteem and blaming yourself for things. And if you're thinking every minute of the day what an inferior person you are and how you're not doing the right things and blaming yourself, that's generally a pretty severe depression. And
suicidal thoughts.
And then the last thing is suicidal thoughts. If you're feeling like life's a big struggle and you just kind of wish you wouldn't wake up in the morning, you're generally in a depression. Now, suicidal thoughts are actually a very handy way of measuring how depressed somebody is. If they're thinking twice a day that, gosh, they wish they were dead, that's one level of depression. If 2 weeks later they're thinking all day long about suicide and having fantasies about how to kill themselves and thinking about it, and they don't think they're near it yet, but they're having all sorts of fantasies of hanging themselves or jumping off the bridge or something, then that's very depressed. And it's also very dangerous, and in that case you really want to take measures to protect the person or to protect yourself if you're having these thoughts. And if sometime later you're having these same thoughts but they're just happening 10 or 20 times a day for a few minutes, then you're getting better. It means your depression is a little less. So it's a handy way of measuring how depressed the person is. But there's other ways too. We have rating scales to rate the concentration and your lassitude and your energy and so on. And now, one way to look at this depression is to think about people who lose their spouse. And they say, well, they're very depressed. Of course they're depressed. He was married for 35 years and he really loved his wife and she suddenly died, and of course he's in a depression. Now, actually, if this situation happened to someone, the fellow often, he's overwhelmed with grief. He feels very terrible. But at the wake, he can laugh and smile and talk about old times with her, with friends and relatives, and he can still enjoy sleep. And after 2 or 3 weeks, he's able to concentrate better, and he's sleeping okay, and his self-esteem is still good. But if you have somebody and they lose their wife and then they just develop a lot of lassitude and low energy and they can't do anything, and they start feeling guilty all the time and blaming themselves, maybe for the fact that she died, and having very low self-esteem, which they never had before, and then the fellow goes and he doesn't answer the phone when his friends call to go fishing. So pretty soon his friends drift away, and then he just quits his job because he's got low energy and he's just not interested anymore. A year later, this guy is isolated, no longer has a job, but he's only 65 and he liked his job, and he's really stuck in a big depression. Whereas if you had treated him right after or soon after his wife died, then he'd be still seeing friends and still working at his job and everything else. Too often, when people lose a spouse, nobody treats them because they say, well, of course he's depressed. Look what terrible thing happened to him. But if you broke your leg and you go to the emergency room, the ER doctor doesn't say, well, we're not going to treat it as a terrible fracture, but we know what caused it. A car ran over you. Since we know what caused it, we're not going to treat it. That makes about the same amount of sense when you get a depression that's caused by bad events in your life. And I just want to repeat this, that it's all of these different symptoms, not just a depressed mood. Because we could have called it something else, like McMullen's low energy syndrome, or we could have called it a lack of pleasure syndrome, or there's many things we could have called it. They had to call it something, and they happened to call it depression.